Well, welcome back to the practical side of medications. So far, we've actually, in this course, assist clients with medications. We've discussed the rules that are associated with medications. You've also had a good go through the major points of Activ's policy and procedures that are associated with medications. And then what we've done is I've shown you how to wash your hands already using the aseptic technique and the correct technique for hand washing before you assist your client with medications. Now what I'm going to do is, and you should have your paperwork in front of you, which is your medication administration paperwork, all right? The paperwork will have a few different forms, and this is particularly relevant to if you are working in Perth, because this paperwork, this pharmacy documentation, comes from Chiara Pharmacy in Perth. Now the first page is called the primary medication chart. This chart is for you to just so that you get an overall view of how many medications Mary's on, and this chart tells you that she's on 11 medications altogether. You don't sign anything, this is just an overview for you. And if you work in anywhere but accommodation, you may not see this chart at all. But accommodation people will have this chart here. The next chart that you're going to need to look at is called the signing sheet. And it's directly connected to medications that come out of the Webster pack. So whenever I administer or assist my client to take medications from this pack, I have to sign this sheet, and I check exactly what medications and do my 6 checks that are on the board onto this sheet. Alright, so that's what the signing sheet is for, and there's little rules associated with that which I'll talk to you about as we go along. Now the next chart, medication chart, is for those kind of medications that aren't tablets. They may not go, they may be eye drops or ear drops, they won't be oral tablets, alright? And it's called non-packed, which means it's not in the pack. These are packed medications, and the non-packed medications may be the eardrops that Mary's on, the Waxol eardrops, or the Refresh eye drops, or the Atalax syrup. All of these kinds of medications will be actually listed on this bluish chart here called non-packed regular medications that Mary takes regularly every day, and so you will need to also go through this list and sign her medications. The next form that you may need to have is if Mary happens to be on any medications that she may need or may not need. Now Mary actually has Panadol listed down here on her chart, so that if Mary's in pain and she needs Panadol, she will have this, and you'll have to actually, and these are called PRN medications. Now PRN is actually short for 3 Latin words. I can't actually remember what they are, but they just mean if necessary or if required. So Mary may need this Panadol if she needs it, and anticoral cream, she's on it, which is for dry skin, so if her skin gets dry she's going to need it. And then she may need the puffer if she's having an asthma attack. If she's not having an asthma attack, then she's not going to need it, alright? But the PRN, if you do ever happen to help your client to take one of these PRN medications, you're going to need to fill out extra paperwork for Activ. This here, every PRN medication has one of these filled out by the doctor or maybe by the chemist, depending what schedule it is and how dangerous the drug is. And one of these charts here will tell you things like symptoms that have to be, that this medication is to be used for, steps to take before medication assisting your client, expected change in symptoms to allow for each response and follow-up. So for example, if Mary suddenly you notice that Mary is short of breath, that's one of her symptoms. Well, that would be listed here, and you would have to get the puffer out and give her 2 puffs as ordered on this PRN chart. Alright, and then from there, the steps that you would take beforehand and after. So you would have to do her respiration rate and again afterwards to notice if her breathing becomes easier. That would be the expected change. Also listed up here is the minimum time between doses of this, and the maximum amount of doses that you're allowed to give in 24 hours, and the actual when you actually will need to contact a doctor or follow up. Alright, so that's listed on that chart, and that will need to be followed. It's like a plan for each PRN medication that your client's on. This chart here is by Activ, and it tells you need to actually record when you do actually, your client does take a PRN medication, the date, the time, the medication name, the medication dose administered, the symptom that it's administered for. For example, Mary will be short of breath, that's a symptom. The time of follow-up, so you'll be checking to see if her breathing's easier and what time that would be, her response, and your signature are needed on this chart. Now, I know in the future Activ is working to get rid of this chart, so you don't have so many charts, but at the moment, currently, you have 3 charts anytime you want to give your client, or your client needs or requires a PRN medication. All right? Now, what I'm going to do is I'm going to start at the top of Mary's chart. So what I want you to do is I want you to go back here, and we're going to work our way through. I'm not going to demonstrate everything. I'm going to talk to you about how to administer each medication and what rules are associated with it. Now, on Mary Harrison's chart, and you've got Mary's picture there, her name and her details, you'll find, if you look at this chart, that there's some orange writing up here that says oranges and penicillin. And whenever you are doing your 6 rights, whenever you check the client that you've got the right client, you must also think, are they allergic to anything? Never ever give anybody anything that they may be allergic to or not sure, even don't go near it. It'll save you a lot of grief. Then when you look down this chart, and this is the overall chart so we don't miss any medications, you'll realise that in blue writing right here, it says PAT medication, and there are 3 PAT medications. So in here, there's 3 medications that Mary takes. She takes them in the morning and 2 of them in the evening. After PAT medications, you'll see non-PAT, 1, 2, 3, 4, 5, and then what you've got is 3 PRN medications. So Mary's on 11 medications altogether. Now with the PAT medications, if you have a look on this chart, right next to the blue writing, you will see on the PAT medications that there are 2 medications that you actually are not allowed to crush. Now if you have a look at that picture of Mary, I can tell you now, she's probably not going to be able to take these dirty big tablets, alright? So you are going to have a problem getting them down her, because that means she can't chew them, you're not allowed to break them in half, and you're not allowed to crush them. The reason we don't crush some medications, and I can tell you Epilum, which is used for epilepsy, cannot be crushed because acid destroys it. So what happens is Mary is required to swallow Epilum whole, which is a very large tablet. It goes right through the hydrochloric acid environment of the stomach and keeps passing on and gets squirted into the bowel, the small intestine, which actually is an alkaline environment. When it's in the alkaline environment, what happens is the pill starts to break down, and the medication goes across into the bloodstream, and from there it will work really well. If you crush it, or if she chews it, or you break it in half so she can get it down, what will happen is that medication will become quite ineffective because the acid will destroy it. The pills that you don't crush are often coated with what we call an enteric coating, or a lining around the tablet, which means it's a tablet. Enteric means bowels. So it will actually dissolve in an alkaline environment, which the bowels are in. So that's a little bit about Mary. And as we've discussed in the rules about what you do. So you need to go back to your rule book, where section 6.6, where it talks about crushing. If you can't remember what to do, it will tell you. Now, if I would give Mary her PAT medications, these 3 here, I would be required to have this ready, get a glass of water, and an individual pill box, and I may need and may not need a medication cup, alright, in which Mary takes her tablets. Now if Mary can't pick up her tablets, or you can't put them into her hand, this has got a serrated edge on it. A pill bop is actually for the purpose, in case you don't know, of piercing the blister, and the pills will actually drop into there. It is very important as part of your duty of care and that you don't contaminate, spread any germs from yourself onto the client. You don't touch the medication. So you use a non-touch technique. So you pierce the blister with the pill box. You can then pop the tablets into the cup and give them to her. Or if you don't have a cup, put them on a clean tissue that she can pick up, or a kitchen dish that she can pick up, or some people actually help their clients to take their tablets using a spoon. They put them on the spoon, and that way they're not touching the medication. Okay, so I've got this ready. I need that, my glass of water, and I may need a tissue that she might like to wipe her mouth with afterwards, and I've got that. So I've got all those ready now to administer my oral. I'm going to do it on a real client. So her name's Karen, so she's going to come in a little while, and I'm going to actually demonstrate for you exactly how to do this, doing your 6 checks and using correct technique. Alright, so Karen will actually come in and we'll do that. Alright, now I'll just need the eyedropper bottle and a tissue. Whenever you're going to actually administer medication, I'll be demonstrating this one as well. You need to actually put your lids either on a clean paper towel or on a tissue. Don't put them on the kitchen bench, either a tissue or a clean paper towel. Put them down on an area that nobody else has had their hands or been using it, because of your duty of care not to contaminate the medication or to actually spread germs from you to the client or from client to client. So that's part of the process. You need to actually work off a little surface that hasn't been a common use surface. They're the eye drops. The next thing that Mary is down for, if you have a look, after the Refresh eye drops, is the Seretide 250/50 Accuhaler. The 250/50 are the 2 different types of drugs that have been put into the Accuhaler. Now, if you've never seen an Accuhaler before, they're round like that. Some of them are purple. This one here is actually a preventer. It's got medication in to prevent asthma. All right? Now, it's just round. What you've got to do is you've got to actually bring that open like that so that the mouthpiece appears. Now, around here, all asthma medication are generally in the form of a powder, a very fine, misty powder, so that the powder can coat the lining of the bronchus here where the asthma is like constricting the bronchus from some sort of allergy trigger. And what happens here, how this is put together, is there's a whole lot of capsules filled up with this powder, this medication powder, and they're actually situated around in a circular fashion inside the Accuhaler. So you've actually, by opening that up there, you've actually got a capsule in place. Now you have to pierce it, so you've got to just push that down. Then all Mary has to do is put her mouth over the mouthpiece, breathe in, hold her breath for a good 10 to 20 seconds if she can as the powder takes effect. Alright? And that's it. That's all she has to do for that. On this side here you will find a little number which will tell you how many capsules are left or how many doses are left. Now Mary has this regularly because this doesn't treat an asthma attack, this prevents asthma. That's what Seretide does. Because there's a cortisone, a corticosteroid ointment in there, what you have to do is you have to rinse Mary's mouth out or get her to have a drink of something or clean her teeth, because cortisone type ointments will actually encourage thrush, and we don't want her to end up with thrush in her mouth. So that's all I want to tell you about the Accuhaler. The next medication that Mary is down for is the Waxol 0.5% eardrop. Alright? So we've got this here, Waxol eardrops. It will have Mary's name on it. Alright? It will also have a dropper put into the bottle. Alright? Now the thing with anything that drops, including eye drops, is that you don't know how fast it's going to drop. So it's very, very important that you always test how fast this is going to drop, because if you have a look at your chart you'll find that Mary is to have 5 to 10 drops, and you've got to count them. If you do 12 or 15, your dose